Hi, welcome to Dr. Lisa Solzenti's podcast. I'm Dr. Lisa, and today we're going to talk about what is functional medicine. It's a common question that I get, and sometimes I think when we're in functional medicine, we just assume everyone knows what it is or that it's more popular, I guess, than it is. And possibly because we're, constantly with each other and functional medicine doctors discussing things with each other, and we don't realize that, our friends and our families and our patients, they might just not know what functional medicine really is. So let's discuss that today. I think it's a great topic. So the definition would be that it's a holistic approach to finding out the biochemical and the physiological cause of your health problem. So instead of treating symptoms like conventional medicine does, functional medicine is going to look into your body systems, looking for leaky gut. It'll check the gut microbiome and determines what's working, what's not working, and why this is happening, so a natural solution can be found. But let's break that down. It's basically looking at the systems of your body. What does that mean? So when you have a problem, we'll call it a symptom. So let's say you have, hair loss, right? Oh my gosh, Dr. Lisa, my hair just keeps falling off. Or Dr. Lisa, no matter what I do in the gym, I work out, I can't seem to lose weight. Or no matter what I do, it doesn't matter how long I sleep, I'm just so tired, right? Those are common symptoms that people come to me with. A lot of moms come to me with kids saying, oh, he can't focus. The teachers say he's not paying attention. We have outbursts. We have sensory problems. These are symptoms. They're challenges. Sometimes you get a diagnosis from it, but primarily it's a response for the body. And what we want to do, and I say this in a lot of my podcasts, is I think of the system as an iceberg. So if you can visualize a big iceberg, and if you're at the top of it, and you're in the water, let's say in a boat, you just see the tip of the iceberg. To me, that's the symptom. So whatever the patient is describing to me, that's kind of what we see, right? That's what we know. We don't know the big iceberg underneath, which would be the causes. So this is what functional medicine focuses on, is this holistic approach of trying to figure out what biochemically can be going on, what physiologically can be going on to cause this symptom or this health issue that this patient's telling me about. So the difference between the two practices, and I'm not saying one is better than the other, that's not what I'm here for. I think that functional medicine is a beautiful profession that complements medicine. And the sad thing is that I don't think the medical world acknowledges how we complement them. We really, really help them. And over and over the years, I just get poo-pooed by so many, and it's sad. It's just sad. But it's not that one is better than the other. They both have different time and place. Medicine has its time and place, but medicine shouldn't be treating all these symptoms. And especially these symptoms that the patient isn't getting a result from. And so you shouldn't be medicating. You shouldn't just keep doing the same thing, nor should I be doing the same thing over and over if the patient isn't getting better. So you have to say, all right, I see this iceberg, the tip of the iceberg, but what I do with my patient is I jump in the boat, we put on, our scuba gear, and I hold your hand and we jump in together and we dive down deep, and we're going to look at what is underlying this symptom, what it could be an underlying cause. So you're looking at biochemical, which is just the chemical changes in the body, and the physiological changes, which could be how are these changes affecting some of the tissues and the organs and the systems in the body. And so that's basically the big difference, is we're looking at what could be causing the symptom. That's huge. We're not treating the symptom. So if someone came to me and said, I have hair loss, I don't just treat the hair loss. I could go right away and say, hey, take biotin. Just take some B vitamins, your hair will stop falling out. Well, yeah, I guess it could be true if that was me guessing the right thing and throwing a dart at the board and hitting the target, But what I should do with the patient is dive down deeper and see what type of system, what could chemically be going wrong in the body causing this hair loss. There's plethora of things. Same with any of those other symptoms that I gave you. And then the other one I think I gave you was I'm really tired, and no matter how much sleep I get. So do you give them something so that they can stay awake? Or somebody who can't fall asleep, you give them something to fall asleep at night. Or do you look underneath, dive deep, and try to find out what could be going on? And here's the second part, is once we figure out or we think that this is the system that's wrong, or this is the nutritional deficiency that's causing the organ to not work, and it could be a domino effect. Like if I want to use, let's say, I'm just going to use this one. I know we use it a lot, but it's my world and it's very simple. If the hair is falling out and you're feeling exhausted, and let's say you're cold all the time or something like that, you're immediately going to think B vitamins, and you're immediately going to think possibly thyroid. So what we have to do, dive down together, is like, look at those, I call these wheelhouses. We have to look at that. So I have to look to see, do you have a nutritional deficiency that could be causing this? I also want to look at the thyroid. But the thyroid, when you have a thyroid problem, it's not a thyroid problem. Again, it's a nutritional deficiency problem. We want to look at that. It's a cellular problem. It could be iodine, B2, B3, magnesium. It could be vitamin C. It could be a plethora of things. It also could be the liver, and the liver really isn't processing and detoxifying correctly. There's also a problem with the thyroid that if you're toxic, let's say that your body is holding on to too much bromide or fluoride and not enough iodine, the thyroid isn't going to work. So these are just these things when you're looking at the biochemical and the physiological way the body works. So if I'm talking thyroid, it's one wheelhouse I would look at for the symptoms at the top of this iceberg. So as I'm diving down deep with you, I'm like, all right, let's check your thyroid out. But when I check your thyroid out, I'm going to run a panel. And I'm going to run a full, thorough panel. The difference between the medical world and my world is we don't test the same. So I will test a full, complete panel. And that would mean your TSH, your T3, your T4, and all your thyroid hormone antibodies. If you need to know more about thyroid, I have a whole series in the podcast that you can listen to. But I'm just using this as an example because it's a quick, easy one out of my mind that I can just pull up. I am going to look at the liver. I am definitely going to look at the gut. The gut is a big connection to thyroid. It's a big part that's missed. It's a big part that's overlooked. So again, if you're not diving down deep and you're not looking at gut microbiome, food sensitivities, you may not get the results you want with a thyroid. The question can be, once we start working together and we start looking at these different wheelhouses and we start seeing things. So if we test your food sensitivities and we find out you have a dairy issue and you can't have apples and you have a nut issue, we take them out and we work on that. And then we're going to look at your gut wall. How much damage is there? Do you have bacteria leaking out? Is it a problem? How hard do we have to work at this? We're going to repair the gut wall, right? And then I'm going to look at the gut microbiome, which, please, if you don't know what that is, listen to some of my podcasts. If you're like, oh my gosh, I don't know what food sensitivity is. What is she talking about? I don't know what leaky gut is. I don't know what gut microbiome is. I am going to come back to the podcast because these are in my season 1. And you really have to scroll down in my podcast to find these. So I think I'm going to pop these back up and start bringing up these topics again so we can bring them more recent. But let's just talk about gut microbiome. I would be doing a stool test. I would be seeing if you have any overgrowths in there. Do you have any parasites in there? Do you have any heavy metals? Do you have bacteria issues? Do we have bacteria leaving the gut, getting into the bloodstream? Lots of things here. So you can't just look, in my opinion, at an iceberg and be in the boat with the patient and just treat the tip of the iceberg. Now you can give them a medication. Again, just like me, I can give B2 and the doctor can give a medication. We're both throwing the dart at the dartboard and we might hit it. We might nail it the first time by guessing, right? Or by process of elimination, by things like that. But diving deep is functional medicine. And not that doctors don't dive deep. They do thorough testing. Like I said, there's time and place. I have had my son in the ICU for 2 weeks and we did thorough testing and, medicine really, really saved him. So believe me when I talk, I'm not against medicine, but I think that there's time and place for everything. And I think functional medicine is being poo-pooed and ignored and sometimes I'm called a quack, I'm made fun of, and I'm used to it. It's been my whole life. Ever since I left the University of Delaware and didn't go the medicinal nutrition route and become a dietitian, and I went the chiropractic route and I went the organic route and I went the functional medicine route and home birth route and all this stuff, I got made fun of. So I'm used to it. No big deal. So let's get back to this. we just got to look at these different wheelhouses. What does she mean by wheelhouses? We've got the gut is really where I start. The gut. So please listen to some of the podcasts again. I'll bring it back up. But the first wheelhouse I do in functional, and every functional practitioner is different, is I go to the gut. I just have been doing this for about 10 years and I get such success with the gut. And that's where I start. And so one of the testings that I would do to really look at what's going on with a patient and to explain more to you what functional medicine is I would be looking at food sensitivity testing. So we want to see, is there a celiac gluten problem? Is there a non-celiac gluten problem? Are there other food sensitivities going on in here? Is there a leaky gut, a gut wall damage? Is the gut wall not absorbing nutrients correctly? Is the gut wall allowing bad things to leave the gut and get into the bloodstream? Lots of questions I have in that wheelhouse. The other part of that wheelhouse is looking at the gut microbiome, like I said, and I'm looking at the gut print of your gut. Like, so do you have an overgrowth of bacteria? Do you have an imbalance? What's missing in this overgrowth, in this imbalance? What probiotic do I need to fix that? Very, very specific. What that stool test tells me what probiotic is right for the patient. And then also, are there any bad things in there? Are there any pests in there? Are there any things that I need to get rid of? So that's really that wheelhouse. If we're having certain symptoms, I might do that thyroid testing. I might do hormone testing. It all depends on the tip of the iceberg, the symptoms of the patient, their history, their medical history, where they've been, what they've done, what tests I'm looking at that the medical doctors may have done. So that's the whole thing. You've got your hormones, ladies. You got all of that, and men, because I've seen problems there. And the vitamin testing, the micronutrient testing is a huge functional medicine thing. We differ here a little bit too, because we will run the medical model, which is looking at the micronutrients in the blood, what is floating around in the bloodstream at the time of the blood draw. That snapshot goes back to 24 hours to maybe 48. Right? We do that medical model, but we also do the functional medicine model, which is looking at the cellular levels of these nutrients. And that goes back about 4 weeks. So we're looking inside the cell, the cellular level of the nutrients, and outside the cell, which is the blood extracellular, the blood serum, the medical model. So there's just going deeper is how I can explain functional medicine. So you can do functional medicine without lab testing, but if you really want to dive deep, we do have these incredible, accurate, and extensive testing that goes beyond the health symptom. And they're really aimed to determine the cause of the health concern or the health problem or the health symptoms. And you always have an option to discuss during a consultation, hey, can I work on this without the testing, or does this require deeper testing? If maybe you've done some testing with a different functional medicine doctor and we can use those tests and you just need to go a little deeper there. Each one of us is a little bit different on how we approach it. I actually have a full program called the Kind Gut, and this is a big program where somebody would work with me for 5 visits. We spread the visits over about 4 months, and we are going to do gut health, and we're going to work on restoring the gut. The first part of the program is revealing what's causing the leaky gut. So we do food sensitivity testing in this, and we're going to figure that out and stop the storm there. And then we're going to determine how damage is the gut wall. And we are going to say, all right, well, what do we do to fix this wall? And we're also going to dive a little deeper and look at that gut microbiome, because after you stop the leaky gut problem, you want to fix and restore the gut. So that's where the gut microbiome testing comes in. So this is a huge program that I do, that I extensively work one-on-one with people on how to reveal what their causes of their leaky gut are, how to stop the inflammation that's going on in there, how to repair the gut wall, and how to restore the gut microbiome. A lot of times when you do just this, you see 80% of the people get better. It's crazy. It's like they just their symptoms go in oh, I already feel better. This is great. And so maybe you don't have to even dive any deeper. And you could just come up and crawl back in the boat and high five each other, right? We did this. And my program actually works with leaky gut recipes and meals and a personalized functional medicine plan and things like that. And sometimes we have to say, wait a minute, we just didn't go deeper enough, or we come up for air, we look at the results, we try this, and we'll go, hey, you know what? Maybe we should do a heavy metal test. Hey, maybe this is MTHFR, maybe there is a toxin we're missing. So that's functional medicine, and the best I can describe it. It's absolutely beautiful. I get so excited about it because we're really going deeper. And that's why I think it's beautiful with medicine, because if I had a patient recently that came to me, and she has a health problem, and she's been in and out of the hospitals. So they were treating this gut issue, this digestive issue with antibiotics. And so when we did the stool test, we found C. diff in her, which is pretty serious. So I had to make a decision, like, do I send her back to the MD and let them treat C. diff a specific way, which is with a specific antibiotic, or do I try to treat that naturally? And that's the discussion that she and I had. And the thing about it was her being in and out of the hospital all of 2024 was creating the C. diff, because the only solution that they were doing at the hospital was giving antibiotics. So what antibiotics was doing for this patient was wiping out the gut microbiome. But C. diff is just it's a bacteria that doesn't really respond to antibiotic therapy. So in theory, if you're wiping out all the good stuff and you don't wipe out the C. diff with the good stuff, all of a sudden that's the weeds that grow up. So when you're looking at this gut microbiome of hers, you were seeing a lot of weeds, like tons of weeds. And when we were diving deep looking at these weeds, we're like, wow, these are C. diff. And that needed a specific antibiotic. And you can try to work with that naturally, and you can go back to the medical doctor, say, hey, this is what we found. I kind of need to give you the right probiotic for this. And that's fine. Because what I'm going to do with my patients, I'm not just going to let that patient go. I'm not going to just let that patient sink by itself. If they were to work with a medical doctor, what I'm going to do is now, after the medical treatment's over, I'm like, all right, we got a lot of work to do. We've got to build this microbiome because we just wiped everything out. We do not want anything to start growing back fast. What happened with her was the yeast grew back. So we, C. diff died, the other stuff died, and the thing that grew back first, the fastest, was now we had yeast. So you see what I'm saying? One medicine can lead to another problem, which can lead to another problem. But it's not that that person didn't need maybe medicine at the time. It's just that I'm there now to guide her on how to rebuild the gut microbiome so it's strong and it's robust, and we don't have yeast, and we don't have C. diff, and we don't have SIBO and all these overgrowth things that were going on here. And I'm just so happy to say that, we worked really hard on this. She did an amazing job. I had another patient that the child was having, focus issues. And what we did was dive deep. We looked at the gut. We found some of these food sensitivity problems, and we worked on them. We pulled them out. Child was actually doing better just by pulling out the food sensitivities, was really doing better. And then when we did the stool test next, we found this weird bacteria in there. It wasn't C. diff. It was just this weird bacteria in there. And we treated that naturally, I believe. We actually worked on that naturally because it was an overgrowth of a bacteria that's normally found in the microbiome. And so we worked on rebuilding, getting on the right probiotic, and just really restoring that and resetting that gut microbiome. Do you believe that the child even got better to the point where the teacher was like, did you put him on Ritalin? Did you put him on, medicine? Like, what happened here? And what it was this child's poor gut was so off. And I'm sure if we went deeper in testing, we would have seen some nutritional deficiencies because the leaky gut wasn't working right. The gut wall was damaged. There was inflammation. There was bacterial overgrowth. There was so much inflammation and stuff going on in this poor child's gut that gut wall is not going to absorb vitamins correctly. So I'm sure we had some nutritional deficiencies, and because we'd have nutritional deficiencies, we're going to have neurotransmitter problems. Some of my patients will do the vitamin testing and find out specifically what the nutritional deficiencies are, and we treat that. And some will do the neurotransmitter test and we balance out that and we fix that. In this patient, we literally just did food sensitivities and the gut microbiome, and I believe we worked on a leaky gut diet for the child, and he did fantastic, like amazing. And so my follow-up with her in 2 months is like, hey, now we can do a micronutrient test if you'd like and really see where his vitamins are. So they all should start absorbing well, but he might be struggling with like glutathione. He might be struggling maybe with B6. There might be an MTHFR issue here. And that's where I even dive deeper. So I can dive down with you. We can come up for air. We can get on the boat, high five each other, and we can do our work that we have to do. And then we can look at each other 2 months from now and go, all right, what else can we do? What else is here to really help my child's physiological and biochemical makeup, these wheelhouses, work better? And that's when we can say, all right, let's put the scuba gear back on. Let's dive down deep and let's see what else we can find in the systems. So that's the best way I can describe functional medicine to you, or at least what I do, how I see it. And again, a lot of functional medicine practitioners probably have a different story, but we all do look for causes of a patient's health concerns or health symptoms, and try not to treat the symptom itself. Now, we're not ripping medical part. I'm going to just leave you with that because, again, if you're going to see a nutritionist or a functional medicine and they're just treating symptoms with herbs or vitamins or supplements, that's kind of the same thing as medicine, right? So if you're going to see a doctor and you have a symptom and they write you a prescription and you go out the door and you treat it with medicine, right? It's the same idea if you went to a health practitioner, holistic, and you say you have a problem and you just take, an herb or you just take a supplement. But I see functional as diving deep with you and digging deeper and looking for the causes before I write up a functional medicine protocol for you. So I don't really like just jumping in and treating a symptom. There might be certain scenarios for that real quick, but really it's about what's going on in these different wheelhouses and these different symptoms, and then what functional medicine plan or protocol do I need to put together for that patient. And then we do that together, and we do a follow-up and we work on that. So that's how I see it. I hope you really enjoyed this. And it's a great question. I loved answering it. So take care.